What's up, guys? It's Chad again. So today I have Mike helping me out. Today I'm going to do a flexibility assessment, and I'm just going to work from really the head to the toes. So the first thing we're going to do is the cervical, a little bit of flexion and extension. What I'm going to do is ask him to actually take his chin to his chest. I'm going to ask him just to look to the left and to the right. And what we're looking for here is just how smooth he rotates from side to side. Looks pretty good. Maybe a little tight in the upper traps, maybe in the scaling just a little bit, but nothing that's causing any pain or hurting, correct? So everything seems to be good there. Nice. So the next thing we're going to do is a little bit of thoracic rotation. So I'm going to ask Mike to sit down in the chair like normal. Grab a PVC pipe. Man, I'm going to ask you just to start off the back of the chair just a little bit. There we go. And then you're going to place this on your back how you would just like a back squat. So right there on the bridge of your scaps. Okay, so what I'm going to ask him to do is really if he will just keep his chest nice and big, and if he'll just rotate to the left and to the right. Looks good. Is there any pain or discomfort there?
A little bit in my left scapula.
A bit in the left, okay, and the scap. So maybe a little bit of a trigger point there.
Yeah.
Okay.
The right scap again.
Okay. Do it one more time for me. What we're looking for really is just to see the degree of the PVC pipe and how far he's coming across in line even with his pelvis. Usually with an internal rotation, we're looking for about, that's with the hips. We're not going for that. So as far as his thoracic mobility, looks good. There is a little bit of pain and discomfort, though, he said, in his scapulas whenever he rotates just a little bit. That may be due to some shoulder tightness. But we're actually going to check that here in just a second. So the next thing we're going to do actually is I'm going to ask Mike to stand back up. So we're going to do the Apley's scratch test. So I'm going to ask Mike to do if he would take his right hand and reach as far back as he can on his left shoulder. It's right here. Any pain, discomfort there, drop the elbow for me just a little bit. Is that okay? Feels good? Nice. You do the same thing on the other side. So left side go to the right. Drop your elbow just a little bit. Hey, we're good? Pain, discomfort, anything? Nope. Awesome. So now what we're going to do is I'm going to ask Mike to turn around for me. So with his right hand, I'm going to ask him to, there we go. I'm going to ask you to reach as far as you can on your back for me. It's right there. Perfect. All right. You relax. I'm going to ask him to do it on the other side. So same thing on the other side. Move back. Reach down. You see there's a little bit of a difference there. So his left side seems to be a little bit more inflexible than his right side. So now what we're going to do is I'm going to ask you to go from the bottom up now. So the right hand coming up, reach up as far as you can to your back. Try to keep your palm out. There we go. All right, so right there. And same thing other side. Oh yeah. There's a. Well, actually, that's not that bad. It's still just a little bit of inflexibility, probably in his pecs a little bit. It's a little bit internally rotated, but other than that, it's not too far off of where it should be as far as coming up and over. Looking at it there's a little bit there that we need to work on. So now what we're going to do is actually get him to do one more thing for his scaps and his thoracic spine. So what we're going to do is actually clear up a little spot on the wall. So I'm going to ask Mike to do a wall sit right here for me. Make sure everything's at 90 degrees. Try to keep your lower back on the wall for me. So I'm going to ask you to do is put your pinkies on the wall right there. Okay, looking forward, you're going to come straight up, flexing up, and trying to touch your thumbs to the wall right above you. Trying to make sure the lower back, everything stays on the wall. Everything looks good. Is there any pain, discomfort there? Do one more time. Try to breathe up nice and slow. No pain in the scaps, anything? Awesome. Cool, looks good. Great. So the next thing we're going to do, we're going to be moving down to the hips now. So what I'm going to ask Mike to do is I'm going to find the PSIS, and that's going to be back here. So that's going to be these the bumps right back here, the posterior superior iliac spine. Where are they at? We'll put this down real quick. So right, there we go. So right there. So those two little bumps right there, I'm going to ask you to put the PVC pipe right there.
Okay.
Now what you're going to do for me, if you turn it this way. There we go. So what I'm going to ask you to do is if you're going to take your right foot and step forward for me. Maybe stand about 5 inches. All right, so now what I want you to do is I want you to turn your hips towards me, coming to the left. Yep, just open up.
Without moving my feet?
Yep, keep your feet and everything turned forward. Where does it feel the most tight at? Right side, left side?
Left side.
The left side, where at? Point to it.
Well,
when you can like go
actually
on the inside? Okay.
Yeah.
All right.
And a little bit right here.
Okay, so a little bit of internal and external rotation. Gotcha. Cool. So now I'm going to ask you to switch your feet. All right, I'm going to ask you to turn the other way for me.
I'm going to face this way. Is that right?
You're staying straight. Yep. Where do you feel it at the most now? Is it almost the same spot?
Yeah.
Okay. Awesome. So you may have a little bit of internal rotation inability on that right side. What we're looking for really is whenever you internally rotate on the hip, it needs to be about 60 degrees. Whenever you externally rotate, it needs to be about 80 degrees. We could do some further tests to check Mike's hips, but typically I'd be doing this type of assessment in a group setting. We wouldn't have that type of time, so maybe we can schedule something else for Mike. But as we're going to move on a little bit, going down a little bit further, what I'm going to do is I'm going to ask Mike to lay down on the table for me. Right here, we're going to check his hamstrings. And whenever we do this, he's going to lay down. We're going to roll up a towel. I'm actually going to use a shirt to just keep that the normal lordotic curve in his spine, so that way he can't cheat by moving his pelvis. So what I'm going to do is I'm actually going to have you raise this arm up. So just right underneath your lumbar spine, right there. Okay. And whenever we do this, what we're going to make sure of is that this opposite leg that's not being stretched is going to stay down, and that these hips and everything aren't going to shoot forward. We're also going to make sure that this knee stays straight. So we're really just going to go until Mike is going to tell me I need to stop.
You can stop
Right there. So he's just shy about 90 degrees, probably about 80 degrees. So we probably have a little bit of hamstring inflexibility that we need to work on there. We're just going to check the other side now. What we also need to be aware of whenever we're doing this is how much pressure we're putting on the actual muscle group itself. How hard am I pushing right now? It's nothing. It looks to be about the same. So he's about 80 to 85% on both sides, which is still not normal. 90 degrees is normal. So he needs to work on his flexibility on his hamstrings just a little bit. So the last thing we're going to do, you can hop off the table for me, is we're going to do the ankle dorsiflexion test. So what that is we're going to go by the TPI standard at 5 inches. So I'm going to ask Mike if you will take off your shoes for me. So if you will put your toes at 5 inches, what you're going to do is you're going to stand here, and I want you to lean forward and touch your toe or touch your knee to the wall for me. Okay. Or just go as far as you can. And what we're looking for, notice how his heel's coming up just a little bit. So what I want you to do is put your toes on 4 inches for me. We'll try it that way. So toes on 4 inches, going forward. Still coming up just a little bit, but not very much. So if you go up, let's go up to 3 now. There we go. Awesome, let's do the other side. So on his right side, he has very limited ankle mobility, or that dorsiflexion mobility. Yep, and we're going to be about the same on the left side. So from the TPI standards, what this normally tells us is that that Mike is more susceptible to ankle injuries on actually both of his ankles now because of that inflexibility there. Are you prone to ankle injuries or not really?
Not really.
Not really?
Yeah.
Okay, so that's typically the standards there. So now what we're going to do is figure out a flexibility workout for Mike to do a stretching routine to maybe get him back to some of the normal standards and maybe make him a better athlete. Thanks, guys.